for video. I think the amount itself, hospitals, especially newly private hospitals, to get on track with us. So we need your help to relate the good news and help us convey, especially private hospitals also, to get engaged with PhilHealth in delivering. Thank you. Dr. Pontia. May
Actually, I have three questions. First is, masasabi ba natin na 100% na yung coverage sa breast cancer? Kasi from 100,000 to 1.4 increase, so can we consider that it's a 100% coverage?
For basic and ward, I'll allow na lang Doc Lema.
Yun po sa basic and ward ng obligation, dapat po no out of pocket. So therefore, 100% is covered. Also, even if it's non-basic, when it comes to the gastusuman po, yung gamot na mahal, dapat po walang co-payment din po yung patient. So, yun po. And the co-payment, if ever, dun po sa mga non-norm, will be for the parang, ano po, we call this fringe benefits po. Yun na lang po yung babayaran.
So, Doc, you're talking about the non-payment members. How about the payment members po? Or it applies to all?
Since universal healthcare naman po naman, so kung hindi pa muna ka-register, mag-register lang po yung patient, we can have, there's what we call immediate eligibility report. So they can avail for this benefit.
My second question po, so hindi po ba ito ganun kahirap to avail yung ganitong benefit? For example, may sakit na si patient, nandun siya sa hospital. Is it easy to avail the benefit? And how are they going to avail?
Kailangan po, sir, contracted yung facility na pupuntahan nila. Yun yung first. So, since, kaya po, minimension kanina kung saan pwedeng puntahan ko yung contracted facilities. Other than that, kung meron pang ibang criteria, baka mas yun natin expound.
Good afternoon. Bukod po sa contracted facilities, sinabi po kanina sa presentation kung sino-sino yung makaka-avail. Rates, kung narinig po at naintindihan, from stage 0 to stage 4. Basically, lahat na sana yun. Ngayon, ang kailangan lang kung hanapin ng patient or ng family ng patient, saan yung pinakamalapit na contracted facility. And then, pagdating po sa contracted facility, para po magpadali yung kanyang pag-avail ng benefit package, we required each contracted facility to assign a Z-benefits coordinator. So, hahanapin lang ng pasyente o ng family ng patient yung Z-benefits coordinator para po siya yung mag-guide sa pasyente. Ano yung mga requirements na kailangan i-submit sa PhilHealth, ano yung mga forms na kailangan po fill-upan. And lahat po ng papers, dapat ang magsasubmit na sa PhilHealth ay yung hospital, not the patient, because we really want to unburden the patient. Kasi alam naman natin na malaman lang na magka-cancer ang isa sa miyembro ng pamilya, malaki na po ang epekto, emotionally pa lang, so what more can actually. So we're really trying to streamline the requirements po. And malaking bagay po yung Z-benefits coordinator sa bawat ospital. Ito po ay empleyado ng ospital. Hindi po sila empleyado ng PhilHealth. And sa mga previous na communications po namin sa mga hospitals at sa patients, malaking tulong daw yung Z-benefits coordinator. So, yun po yung tumutulong sa kanila para ipaalala kailan ang next check-up, ano yung kulang niyang requirement na kailangan comply. So, para sa tanong niyo po, mapapadali kung hahanapin po yung contracted hospital at yung Z-benefits coordinator sa loob ng contracted.
One more question. This is the last question from me. Ito po, syempre lahat po tayo ay hindi mayaman. Mahirap tayo mga kababayan. So paano po yung, kasi kailangan ng requirements para ma-enroll doon sa CBN. Sino ang mag-shoulder doon sa kanilang pagpa-exam, doon sa test para ma-meet yung requirements. For example, PhilHealth member ako, pwede ba yung mga requirements ko doon ma-cover din sa PhilHealth?
Thank you po, magandang tanong po yan. Okay, mga diagnostics. Dati po kasi, bago ka makapasok sa benefit package, yung mamo, and ultrasound, mammogram, and ultrasound, minsan sagot ng patient. Pero ngayon po, sagot ng PhilHealth. Especially sa mga pasyente natin na yung malalaki na yung bukol, minsan kasi dinidisregard ang tinitingnan. Kung kaya niyang tisin, titisin niya. So pag sigurado siyang cancer, ang mammogram at ultrasound po ay sakop ng benefits for diagnostic, under the diagnostic test package. And if I may then message, meron po rin nakaabang na benepisyo para sa mammogram at ultrasound sa ating mga primary care level under the consulta package. So, mas magpapalawak po yung access sa serbisyo para po yung mga at risk for breast cancer, especially kung meron kang kapamilya na may breast cancer sa immediate family or sa relatives mo, mas maganda po na ma-prevent, no, or early detection ang tawag po through mammogram and ultrasound. So, magpapalawak po yung access at service coverage ng PhilHealth for that mammogram and ultrasound service.
Thank you, Ma'am Merla. So, but we now proceed to, sir, pagkatapos po ni Dr. Hilda, si Sir Ian. Then, hindi pa po tayo nag-entertain ng tanong sa kabilang pumunan. Pagkatapos si Sir Ian ay wala po mong tatanong doon. Sige, dito na tayo sa teacher booking. Dr. Hilda.
Good afternoon, Hilda Ong from DWPL Renate. Itong kanina na-present po ni Mr. C. Una, I'm happy, excited. Pero after the presentation, bigla akong nalungkot. Kasi first, ilan lang ang contracted hospital. Second, ang hospital pa na accredited is Avenue and PGH. Hindi ko minamaliit ang government hospital. Kasi yung dalawang hospital na yun, para lang sa mga indigent, sa mga walang pera, punong-puno na sila. Tapos itong may mga cancer na sabihin natin na sa class B, C, dinawag na natin sa yung A. Natural, malaman mo lang na may bukol ka. And then kapag may bukol, sabihin ng doktor, you need to undergo biopsy. So yung biopsy po niya, hindi po siya mako-consider kung hindi pa siya na-enroll under the Z benefits for breast cancer. So, sa pag-umpisa pa lang, medyo for me, parang malabo sa isang pasyente na masabi ng tayo ng doktor na meron kang bukol o sabihin natin biopsy, tapos malaman namin cancer siya. Yung time is precious, time is gold. How long po ba may bibigay ng PhilHealth yung authorization na pwede na siya pumasok sa Z benefits? And then, yung mga doktor, siyempre meron tayong mga kanya-kanyang doktor na nag-handle. And then, papapuntay mo natin sila sa East Avenue, PGS, wala naman na, hindi namin kilala yung doktor. And then the procedure. Hindi ba mababago ng PhilHealth kasi mahirap po makaroon ng cancer. Yung taong may cancer, sobrang depressed. And then yung the process, parang mahirap. Parang for me, maganda yung benefits pero parang mahirap para sa cancer patient.
Before we answer your question, ma'am, we'll address your question, no? Pero do you have any suggestions, ma'am? May naisip ako yung pwede i-suggest.
May suggestion sana, dito pa lang sa initial, yung sa sabihin natin yung may symptoms na may cancer siya. Sabihin nung pagkapa, may bukol. Sa pagka may bukol, karamihan yan, sabihin natin 75%, masasabi natin may cancer. Pero pagdating po dito sa ating sa Z benefits, parang hindi niya ma-avail. Unang-una, the hospital is not contracted hospital. And then kung pupunta naman sila doon sa accredited, like the East Avenue to GH, ang haba po ng pila, kailan po sila ma-accommodate?
Okay, I'll address your question and then I'll pass it on to Doc Lem, baka may dalitan si Doc Lem. First of all, remember, kaya talagang kailangan namin yung tulong ninyo to disseminate the information. That's the first. Secondly, tulungan nyo kami to increase the number of contracted. Kasi we agree di ba, konti pa lang. But remember, someone asked a question earlier. Kasi dati, 100,000 lang. Kaya hindi pinapansin ng mga hospitals. It's not worth the trouble. But now that it's 1.4 million, sigurado maraming, there'll be much stronger interest. Diba? So again, I think we made the important first step already. Diba? So sabi nyo, happy kayo, diba? Although sana, mas maraming contracted hospitals. Now, the second step, which is for me the easier part, diba? Just help us disseminate the information, help us spread the word, spread the good news, diba? And then at the same time, help us also increase. Ano po, siyempre, ilan lang, like you said, ilan lang hospitals, diba? So dapat damdamin yan. But at least that's the easier part na. Kasi anyway, we increased already the amount, diba? By a very substantial amount. So that's how I'll answer, that's how I'll address the question. Dr. you might want to add anything else?
Yung isang question po na on the pre-authorization. Currently po yung turnaround time for the pre-authorization. So, 2 to 7 days. So, but
2 to 7 days.
7 days.
Because as meron din po plano, we'll try to shorten that if possible to give siguro priority for this because as I understand that, as we all know, this with the cancer patients in the being urgent care. So we'll work on shortening po the turnaround time for the pre-authorization.
Thank you, Dr. Clem. Merong isang question dito pinadala po sa atin, and this might be one factor, no? Bakit po yung bilang contracted hospitals natin ay challenging, no? At the moment. The question is from Italu. Sabi niya, do hospitals need to meet certain accreditation and quality standards to be contracted for breast cancer package? Are the standards challenging for the hospitals? So, ang tanong lang challenging, baka naman challenging yung mga contracting criteria ng PhilHealth sa mga hospitals, sir.
Thank you, sir. I'll ask the points to address the question.
Thank you, sir. Like any other hospital or health facility that wants to be paid by PhilHealth, kailangan po accredited ang hospital before hospital gets contracted for breast cancer. Yung accreditation requirement po natin ay napakadali. Kasi as long as licensed yung hospital, it's as good as almost automatic accredited na. Mag-apply lang siya for accreditation and pay small accreditation fee. Ngayon naman, for the contracting standards, essentially, kung ano yung services na required for the benefit, in this case, breast cancer, kailangan lang meron siyang capability to deliver these services. So, ganun lang po. And gusto ko rin i-emphasize yung multidisciplinary team. Kasi ang approach natin sa Z-Benefit ay yung multidisciplinary approach to treatment. Diba? Kasi sabi nga kanina ni Ma'am Merla, gusto natin ma-unburden yung pasyente kasi napaka-catastrophic magkaroon ng breast cancer. So, yung multidisciplinary team within the hospital makes it easier for them to manage the patient and for the convenience also of the hospital. And better outcome. Thank you.
Thank you, Doc Poch. Sir Ian, please.
Sir, good afternoon po. Ian Maghanay from Malitang Agency. This question is intended for Sir Emmanuel Desma Jr. Good afternoon, sir. Sir, to clarify, may expiry date din po ba yung availability ng benefits package for breast cancer patients? Or once na ma-exhaust yung 1.4 million pesos, hindi na siya pwede makapag-avail? To add another question, taxable din po ba ito sa part ng patients or kahit hindi na? Thank you po.
Thank you for your question po. Even regarding the expiry date po, Ma'am Marla will address.
Expiry daw ba? Or validity?
Salamat, Sir Ian. Yung 1.4 million is just the maximum amount that a patient can avail for one cycle of care. That means surgery, chemotherapy, other cancer drugs, and then naman doon. Tapos yung surveillance, kasi kung cancer patient siya, meron pong parang monitoring, no? So may surveillance package na pinakita. The 1.4 million is just for one cycle of care. Yung surveillance example for the following year, meron pa rin siyang mga laboratory, sigan siya ng doctor. So, pwede pa rin pumabi ng benefit package for the surveillance part. And then, that has no expiry. As long as the patient is enrolled in the benefits, pwede po siya maka-avail ng package na yun. And yung kung tinatawag natin hormone therapy, it's an oral cancer medication. Oral yun, parang tablet sila. Minsan po, 5 years or up to 10 years na piniprescribe. And the good thing po, covered pa rin po ng benefits one. At kung meron pong recurrence, halimbawa, ganoon po natin, pwedeng maulit ang cancer sa kabilang breast, no? Pwede pa rin po maka-avail ng benefits. Nagkaroon ng recurrence po sa other breast. So, wala pong expiry in that term. Nasagot ko po, Sir Ian.
Thank you po. To add another question, taxable po ba ito sa part ng patients or kahit hindi na po?
Taxable.
Ang taxable income kasi is for the health facilities and not for the benefit packages itself. Kasi service and corresponding amount. I think include tatanong niyo po. On the part po ng PhilHealth, it is not taxable. Sa patient po ba? Sa patient, it is not taxable to patient. But it is directly paid by PhilHealth to the health facility or yung contracted health facility. Meaning the amount goes directly to the contracted for each service availed by the patient.
Thank you. So we now go to HMO Philippines, then kayo.
Good afternoon, sir. Len Hernandez po, HMO PH. Napansin ko lang po, we have 21 accredited hospitals for the city needs. And if we're going to see the logical of it, most of the hospital is accredited under PhilHealth, right? So why don't we entice all those hospitals to be accredited for the benefits? Para na sa ganon, dumami yung hospital na marami pa siya hindi nakaka-avail sa buong Pilipinas. Hindi po ba? Kasi we could do a simply as form of accrediting hospital for the C benefits for the cancer patients, since almost majority of the hospital is member of it.
Thank you, ma'am. Opo. Sir Mandy.
Thank you for your question po. I'll answer your question na lang possible to Doc Coach. No? May dati na si Doc Coach. Maganda po yung suggestion nyo, pero it might be difficult to accomplish because itong mga hospitals, lahat yan, when we come up with a contract, may mga deliverables sila. Diba? So not all these hospitals can come up with the deliverables. So if you kasi ang sinasuggest nyo, parang umbrella automatic, lahat, diba? Lahat. mga iba dyan, hindi makaka-deliver. That's why we use that. That's why we have a policy where we can segregate the ones who can come up with the deliverables versus the ones that cannot come up with it. Diba?
Sir, pwede naman po yung mga malalaking hospital kasi most of the
Please use the mic, please, para po, for record.
most of the hospital na malalaki, meron po sila breast treatment, may mga mammogram sila, may mga CT scans.
So baka sorry mama. So baka maybe in line with that. Kasi earlier sabi niyo kung pwede lahat ng hospitals, diba?
Yes.
But maybe it's just the big ones.
Yes.
Baka pwede namin tingnan.
Yes.
Kasi that's what.
Kasi sir, yung mga malalaking hospitals naman na nag-o-offer rin ng mga breast cancers.
Yes.
Meron din naman na mga yung diabetes.
So with that po, baka mas plausible kasi yung malalaking hospitals.
Yes.
Pero hindi
If
pwede
in
lahat
case
yan.
na may mangyaring aksidente sa'yo in remote areas, ang unang-unang sinasabi ng hospital, hindi namin kaya yan, itatakbo kasi mas kaya. So, they know the capability. So, kung itong malalaking hospitals so being enticed na maging member for the Z benefits, mas magiging accessible sa mga taong may ganun sakit. Kesa yung, like for instance, if I were in the lower part of Mindanao, o papalayan na po namin sa Cebu, ando tayo sa Cebu guys, sa Cebu. I need to go to Vicente Soto, which is at the center of Cebu City. Magbabarko pa ako paano makapunta doon. Eh, samantalang doon sa Cebu, yung malaki ng mga hospital doon, pwede yung takbuhan, nagagamot din naman sila ng breast cancer patient. Yun lang po yung logic na nakikita ko. Para at least kahit paano, at least din yung burden dun sa may sakit.
Sige po.
Kasi dito po sa Manila, sa totoo lang, napakahirap pong pumila sa HGH. Honestly, napakahirap po talaga. Kawawa kahit po yung alam mo walang pera, kawawa sila. They have to be at the hospital at 3 a.m. para lang sa isang pinaka-check up. Kasi my cousin died there na nasa loob na ambulansya, tinasfer ng Cavite Memorial Hospital, na dinala doon, pero pinagpintay dahil, pero may ano na yun, ha? May ano na ng hospital. Marami kasi silang pasyente. Yun lang yung ano. Hindi ko minamalit ang PJH. PJH is the best. Pero in terms of, nakakainis.
Understood po, pero I also want to add one thing, no? Pagdating po sa contracting, the facility should agree with the terms of the package.
Yes.
So kailangan, diba? That's why, diba, there's a process. There's a application process, and then we have to go through the motions. Kasi, dapat, sang-ayon sila sa first terms ng package. So, anyway, but,
So, kung malaking hospital, hindi mo natin yan.
May encourage.
May encourage. Hindi yun. Kumbaga, maybe probably the first step is we could ihain natin sa mga malalaki. Kasi even if it's already here, 1.4 million, baka pwedeng to mag-apply. Kung ayaw nila, okay lang. Pero I think most of the private hospital, they're gonna jump into it.
Well, Sir Nalvi, actually, our regional offices are aggressively marketing this about the approach.
Your suggestion is okay naman, ma'am. We'll consider it. And since we face hospitals in our daily work, unfortunately, yung reality kasi is not all big hospitals, or siguro you're referring to tertiary hospitals, are created equal. Sabihin pa natin lahat sila tertiary. Pag sinabing tertiary, ano yan? It's licensed by the DOH as level 2 or level 3 hospital. But not all hospitals that can perform major surgeries, like tertiary hospitals, are capable of delivering the needed services for the first CA package. Yun ang sad reality. Kasi pag sabihan nila, the devil is in the detail, undergoing naman yung mga ganun po. But we're targeting them in general para lalo na dito sa NCR para mas dumami ang ating providers. Given like NCR has the bulk of the population ng bansa. So yun po ang talagang mission namin for the rest of the year to increase the current contracted hospitals for ZK.
Thank you, Doc Coach. Definitely po, for our part, we will aggressively market this to the hospitals. And our regional offices are doing that aggressive marketing. Talagang yan, one-on-one, no? Mga meetings. Pero sabi nga ni Doc Coach, kapag ka nasa contracting process na, doon nakikita kung makakapasa ba, no? Yung, kasi we have to make sure na ma-deliver yung services to the patient and ensure quality. Ma'am, please. And our next would be, yan, si Sir Glenn, and then si Ma'am. Sige, Ma'am, please.
Good afternoon, Eunice Hilario ng Filipino Mirror. Congratulations sa parang expansion ng benefits. Nabanggit kanina na from cancer stage 3B to stage 4. Meaning, pag sinabi mong nadagdagan ng sahog ng package ng benefits, madadagdagan din yung pasyente. Kasi yung mga 4, stage 4, sab sila doon. Ang tanong ko is, kanina na-present din na dalawa lang dito sa Metro Manila yung accredited na hospital. Paano po ngayon yung kung madadagdagan po yung mga pasyente na mabibilihan po ng package na to, paano po ma-accommodate po yung dami ng mga member?
Again, we hear you po, no? Kaya that's why I said, sa inyo, diba? We all know we have to increase, diba? The number of facilities. Now, with the higher amount, diba? Much higher amount, we feel that there'll be a lot more interest from the facilities, diba? So tulungan niyo rin po kami, diba? To spread, to disseminate, to spread the good news, to spread the word, diba? Para ma-increase po namin. But we agree with you po, completely. We have to increase kasi we have to facilities. Pero mangyayari po, diba? Umpisa pa lang naman doon. We are optimistic and we are confident na manadagdagan po yung facilities. I-increase po yung number of facilities.
Thank you.
Thank you po.
Follow-up ko lang po, since 2013 or 2012, yung package ng breast cancer, why only now ulit na parang nadagdagan yung beneficio sa bakit tumagal?
Actually, a good question also is why did it take 12 or 13 years for us to increase the benefit packages? Maybe we can ask, yung mas matagal sa PhilHealth. I don't know how to address the question. Who wants to address the question? Ma'am, go ahead please, ma'am. Thank you, ma'am.
Hindi po ako pinakamatagal. Pero sagutin ko po kasi kami yung team na nag-develop ng Silentic Smart. So it's not really only now na we try to adjust the package rates as early as 2012 and about 2014. Nag-propose na po kami ng increase in the package rates. Kasi nakita na kulang. Pero hindi po kasi na-prioritize at that time. Depende po sa priorities ng management. So we're really glad and fortunate to have supportive management ngayong taon na po ito. So katulad ng sabi ko inaprubahan ng board. Hindi po only na matagal na po natin gusto. Pero dito na, di ba? So we really just have to be grateful na nandito and ang laki talaga. Hindi ko po nakwento. Kwento ko sa mga. Nagulat po yung grupo ng mga doktor sa increase ng package na po. Pero they're happy. Ang fear nila ngayon, natagsayin sila. So, paulit-ulit naman po po natin question, di ba? Konti lang, like sa Manila, 2 lang. Pero kaya po talaga, konti lang. Kasi they are not attracted to the package rates. 100,000. Pero right now, kanina lang may nag-text sa akin, paano namin babaguhin yung application nila? Kasi parang nag-apply na sila, pero gusto nilang bawiin kasi they have to propose a new set of yung co-payment. So, antay po tayo ng mga 3 to 5 months, madadagdagan po yan. Dahil sa ganda ng package. So, thank you very much.
Can I just add also, thank you, Ma'am
Thank
Marla.
you. Thank you.
Just answer. And like I said earlier, Ma'am, we have started increasing or enhancing the benefit packages, but we're definitely not going to stop there. Umpisa pa lang to po. Marami pang mangyari in the coming years. Just want to reiterate that. Thank you very much po.
Thank you. So, Sir Glenn, where go?
Ay po, magandang hapon sa inyo. Ma'am Sir, pwede bang para masigit na mautumaan ng mga kababayan natin? Halimbawa, ako ay nadetect na may breast cancer, nagpa-check up na ako, may papel na ako. Okay, saan po ako pupunta agad and ano po yung magiging proseso nito? Please.
Una-una, ano po pinagdaanan ng pasyente?
Okay, kapag halimbawa may kukulo, diba, nagpapacheck na siya, mag-mammogram, ultrasound, pagkakuha niya ng resulta, ma'am, ano na po yung gagawin ng please para ma-avail po ito ng ganitong package?
Sa pagka ng mammogram ultrasound, ang standard po is dadaan na siya sa biopsy. So, biopsy siya para malaman kung anong stage ng cancer niya. So, doon din sa contracted hospital yun, or pati rin sa hindi contracted hospital, kasi ang biopsy naman ay regular benefits. So, pag confirmed cancer siya, hanapin niya, nasa website naman po yung listahan ng mga contracted hospitals. Kanina update yun periodically, no? Hanapin niya saan ang pinaka-malapit na contracted hospital sa bahay niya. Tapos, doon po siya pupunta, hanapin niya kung sino yung benefits coordinator. Tapos po si benefits coordinator, i-check po yung mga resulta ng mammogram, ultrasound, and biopsy. And i-explain po sa pasyente ng coordinator what is Z-benefits, ano yung kailangan niyang sundin sa Z-benefits. Kasi kapag Z-benefit patient ka, meron kang responsibilidad din na sundin yung instruction ng doktor sa'yo. Kasi di ba may mga pasyente na sa breast cancer po talaga, may mga babae, lalo na yung mga younger age na ayaw nila magpa-chemotherapy. Why? Kasi makakalabaw sila. So the Z-benefits coordinator has to explain this to the patient. Pag pumayag ang patient na may-enroll sa Z-package, meron pong tinatawag na pre-authorization form. So ito, checklist po ito na sinasabi na, cancer yung patient, tapos meron na ba siyang nagawang surgery before for cancer, chemotherapy na ba siya before, ganyan. So it's a form that is submitted by the hospital to the PhilHealth office. And then in 2 to 7 days, lalabas po yung approval, tapos isi-schedule na po ang patient for MDT planning. Yung mag-uusap po si Sir John, yung Surihano, yung medical oncologist, sila po yung doctor in charge of chemotherapy, and radiation oncologist. Ibang patient po kasi kailangan ng radiation therapy. So yun po yung tinatawag ng multidisciplinary team. Gagawa sila ng plano para sa patient. And then, kasama sa plano, kailan ang schedule ng operation niya. Or kung naman masyadong malaki yung bukol, sometimes, inuuna yung chemotherapy bago operahan. So that's called neoadjuvant chemotherapy. So yun kasama sa plano nila yun. So pagka nakapasok naman na po sa Z-benefits, tutulungan na ng Z-benefits coordinator yung patient at i-guide ko ano yung mga next steps.
Pag kailan niyo malalaman pag-approve na, paano yung magiging proseso niya? Babalik ulit?
Tinatawagan ng coordinator yung patient. Tapos sasabihin ko kung ano update. Kung may schedule na ganyan.
Tama ba? Ikaw yung effective na, sir? Effective na ito?
Yes.
March
30.
March 30, 2024. Actually, this came out in the media a few weeks ago.
Sige, sir.
Sabi nila it will be effective in July. So, but just to clarify, it's been effective March 3rd, 2020. Okay po.
How's it so far, sir? May mga nagpupunta na po ba?
Any feedback po?
Oo.
Sir, kasi existing naman na itong benefit package. So, yung 21 hospitals, meron ng patients. Opo, tinasan lang talaga yung rates and i-expand yung package. Ang tanong kasi dyan, mas tanong din namin po, meron na bang mga nag-a-apply ng hospital patients? Hindi lang sila makapunta sa hospital, wala silang pambayad ng mammogram and ultrasound and check-up. So, with the Z-benefits, sana ma-push natin yung patients to go to the contracted hospitals and also increase the number of contracted hospitals.
Again, sir, just to add, sorry sir, just to add to what Ma'am Merla said. So, that's why, please help us, diba? Kasi we need to, more importantly, is to increase the number of hospitals. So help us spread the word, spread the good news. Diba? Para, at saka now that it's increased from 100,000 to 1.4 million, marami din difference yan sigurado, which is a matter of spreading. Thank you po.
Thank you, Sir Mandy, and thank you, Ma'am Merla, for that super detailed na proseso.
Very good, ma'am.
Ang ganda po, no? So, merong, at ang maganda po dito, merong Z-Benefits Coordinator na tinatawag. So, pananagutan yung contracted hospital to us. At yun talaga ang Dubai, no, sa pasyente. So, so we are now down to our last 3 minutes po, no? So, we have to hurry. So ma'am, kayo po, then si ma'am, please.
Yes, good afternoon. I'm MG, Manager of DCMG Online. You have our commitment to help to disseminate this very vital information from the two publications, also by the Canada. But my question is, how to face the challenges and modality, especially those regional offices. Kasi po, nabanggit kanina, bakit kahit isa wala tayo sa barn and sa region E? Paano po kaya yung challenges and approach na magkaroon tayo ng contracted hospital sa barn, especially sa barn, may mga provinces na top-4 pa rin tayo, then sa region E.
Thank you for that, ma'am. Just give us a little more time, ma'am. We are addressing all of the issues. We are aware of that po, no? Napakalagay ng PhilHealth, diba? It covers the whole country with 17 regions. Our database is 110 million. So, pero po, give us a little more time. We are really addressing and trying to resolve all of those issues, no? And we are really working 24/7 to move that forward. Dapat po kailangan, ma'am. We've noted on that and we are aware of that, no? We will resolve that po.
Actually, sir, babalikan po natin yung mga friends natin from the media as to the developments po kung natatagagan po, no, yung ating contracted facilities po. Babalik tayo sa kanila, sir, to update them kung may mga dagdag na po. So, salamat po sa inyong concern and your support.
Very good question po.
For your question, please.
Good afternoon po. Ako po si Rain Alberto from Business Mayor. Gusto ko lang po i-clarify, yung pag-a-avail po ba ng Z-benefits, kunyari di po ako PhilHealth member, paano po yun? Parang meron po bang minimum na contributions bago po makapag-apply sa Z-benefits? Or kunyari po paying na ako before pero na-stop yung payment, magiging eligible
Po, kasi po, just to clarify something, no? Which just shows that how kulang sa communication sa PR ang PhilHealth. Alam mo, everyone, yung database, I mentioned earlier, if you heard, our database is 110 million. Everybody, from the day you're born to the day you die, is covered by PhilHealth. Which means lahat po miyembro, 100% miyembro. No? So, again, a lot of people, I'm not surprised because even other congressmen and senators say that there's so many people who don't know that. So it just shows that we have to move forward. We have to improve our information dissemination at PhilHealth. Now, in line with that, dahil lahat miyembro, ang kailangan nyo lang po gawin, kailangan mag-register na. Diba? And we're making it very easy now for people to register, diba? Even online and all that. So I hope that addresses your question po. No? Lahat covered kasi lahat miyembro. Ngayon, pag hindi pa kayo register, kailangan mag-register. So, you want to add to that?
Pero paano po yun kung kunyari wala po akong contribution sa process?
Meron kasing tinatawag tayong yung dalawang miyembro kasi ng PhilHealth ay categorized into two cases. Like si Lord, direct contributors and indirect contributors. Yung mga indirect contributors, yun yung mga members na walang capacity to pay their premiums. So sila usually yung mga indigent, PWD, yung mga senior citizens, etc. Basta yung mga for peace ng DSWD kasama sila. Ngayon, kung walang capacity to pay yung pasyente, to pay the premium, pwede namang mag-enroll to the point of care. Meron tayong paraan para dyan. Register lang kayo through the hospital. Magsasabit na kayo ng PhilHealth member registration form. Kung hindi pa kayo registered, and we will submit the name to DSWD for inclusion in the NDF subsidy. So, ganun po yung process ngayon. So, yung mga walang premium payments, ay pwede pa rin mag-avail ng PhilHealth benefits.
So that's the beauty of the universal healthcare law. No? Lahat tayo immediately eligible to the benefits.
And just to end, sir,
Yes,
sir,
yes,
just to end, I hope you address your question, ma'am, no? Then at any point in time, please reach any of us, you can walk me through the whole process, no? Walang problema, just get in touch with any of us. If you walk me, madali lang po, you walk me through the whole process. Thank you po.
Thank you, Sir Mandy.
Next, last question for Lina lang po. Since nabanggit niyo na rin po kanina yung sa net income ng PhilHealth. Tama po ba yung figure na for 2023? 23 din ang net income. Parang nakita ko lang po kasi siya sa financial statements.
Wala po dito si Sir Renet, pero alam ko it's much higher than that.
How much?
Hindi ako magpo-comment, pero malaking nakikita namin.
Kailan po sila nililinis?
Ayun, Ma'am Mary, you wanna comment? Ma'am Mary is also our finance man.
Yes po. Kasalukuyan pong ongoing yung audit ng COA. So once na natapos po yung audit, and we will be able to usually middle of the year or third quarter.
Meron po ba kayong income target for 2024? How much?
Meron naman siyang income target. So, hindi lang po clear pa, no? Kasi meron pa tayo inihintay na advice dito ng kanya regarding sa implementation. But as of now, since ang basihan po namin is the law, we're supposed to increase it to 5% na. But, so, yung pong based on that implementation of the increase, meron naman po tayong mga targets dun sa
Is your question income target or premium contribution? Okay, clarify.
Net income target.
net income. For 2024, marami po tayong nakalata na benefit enhancement. So, if this will be implemented within the year, medyo mas malaki po siya compared to our collection. So, ang net income po natin, na-expect po natin na kumbaga ang target talaga natin is really not to earn, no? So, gusto natin ibigay lahat as benefits yung ating matatanggap. So, yun po, kung ang talagang balak natin, target natin is really not to earn. So, ang net income po natin is to break even.
I'll comment po, at least, sa akin rin Ma'am Mary. Kasi you're asking about 23 billion, tapos tama ba yan, mas mataas ba yan? Actually, I know it's much higher, but I want to comment, and actually, sinabi na rin yung Ma'am Mary na PhilHealth kasi, unlike most of the corporations, or most of the big banks, most of the top corporations, diba, San Miguel, PLDT, Ayala, ang habol mo, bottom line, dapat malaki na ng net income yan, diba? Stockholders, dividends. Ang PhilHealth, but not po. Pag mataas ang net income ng PhilHealth, ibig sabihin niya, hindi maganda yung trabaho niya. Diba? So if we have a net income, for example, of 100 billion, ang unang makakisert ay hindi tama yung papatakbo ng PhilHealth, hindi maganda. Kasi ang mandato kasi ng PhilHealth is really, it's not about to make money. Diba? We're not out there to make money. We're out there for the healthcare and the health services of the people. Diba? So if we have, for example, let's say our net income is 100 billion or 200 billion, mali yun. Kasi ibig sabihin, hindi ginagamit yung pera for the enhancement of the benefit packages, which we should do. What we should do kasi is minimize the out-of-pocket of the people. Diba? Yan ang target namin. That's why I keep saying, ever since I joined, I've been here for maybe 15, 16 months. Talagang I'm hoping and praying na hindi masyadong malaki yung net income. Kasi ibig sabihin, hindi tama yung ginagawa namin. Diba? Again, we cannot be compared with the other corporations. Diba? So, it's ironic. Diba? Pero if you say, ako, malaki ng net income ng PhilHealth, ayaw namin yan. Diba? For us in senior management, we don't want to hear that. We want to hear that the packages are being enhanced, the benefit packages are being enhanced, or like it says in the charter, diba, dalawa lang yung purpose ng PhilHealth, either to enhance the benefit packages or reduce the members' contribution. Yan talaga trabaho namin, diba? Make it easier for the members or enhance the benefit packages to make out the packages. I hope that answers your question, po. Thank you very much.
Thank you, thank you. So, one last question.
One last for Dr. Bautista. Many of our kababayan, especially in rural areas, we have limited access to healthcare facilities na doon naman offer sa mga breast cancer patients. Yan ba ang dahilan, Doktor, kaya maraming late diagnosis? Kasi yan pa rin ba ang problema, yung late diagnosis. For President Ledesma, what measures will be taken to prevent fraudulent claims? Siyempre, nakipera yan, baka may last na tuloy.
Okay, before Dr. I will address your question, I just have two things to say. The first is si PBBM, during the campaign and up to today, tuloy-tuloy pare-pareho yung sinasabi niya, actually, during the first meeting, kasama niya sa mga for all programs. Sabi niya, we cannot expect the poor, the indigents, we cannot expect them to go far away, to go to the health hospitals and the healthcare services to address their medical needs. The government has to work out a way in such that we will bring the medical services to the people. Kasi diba, hirap yan, walang transportation, walang connectivity, hindi sila diba? So that's the first, diba? So we can expect, so dapat tayo yung mag-reach out, diba? Now, you're saying on your question on fraudulent claims, diba? Again, diba? I mean, when I joined PhilHealth 16 months ago, I was asking around, clearly yan ang number one pinakamalaking issue sa PhilHealth, diba? Ang daming fraudulent claims yan. And if you really, I like to think we're addressing it, no? Putting the head and group by the forms. No? Now, if you really address that, billions ang masisave ng PhilHealth, no? So despite our big cash position, we're still working on that. And with full digitalization po, no? Wala po lang dito si Ma'am Jovi. Ma'am Jovi is heading our information systems, no? And together with the ICT, together with the ICT, CSEC I1 and USEC Dave, no? We are addressing that. And when we reach full digitalization, kasi for the advocacy ni PBBM yan, yung fraudulent claims po, sigurado, mababa yung amount yan. Kasi, di ba, a lot of it happens in manual, kasi so I hope that addresses your question po. I think Dr. wants to add a few.
Yes, Dr. for the first question, please.
For the first question po, in general naman po, it's related to the health-seeking behavior of the Filipinos. So, karaniwan po kasi ng Filipinos, gusto parang nagpapatigil lang pag talaga ng sama ng pakiramdam or medyo malala na yun po karaniwan. And sana, kaya po meron na rin po tayong primary care package ngayon sa PhilHealth. Pinopromote din natin yung konsulta kung saan kahit wala pa pong sakit yung mga Pilipino, dapat po nakikita na sila, na napo-profile sila kung ano yung problema nila na malaman po agad. Pangalawa, it's pwede na rin po natin sabihin na most likely dahil yung walang kakayanan silang, alam nila wala silang kakayanan magbayad. Kaya yun na rin po yung nag-hold sa kanila to getting medical care or seek medical care. Kasi alam nila, pag pumunta sila sa hospital, magastos sila ng malaki. So, kaya po nandito rin nagsisikap po yung lahat para po ma-increase po natin lahat ng benefit packages ng PhilHealth para masagutan po lahat ng problema ng ating kababayan sa kalusugan.
So thank you, Dr. Clem. We apologize, but we have to wrap up our session for this afternoon. And well, ladies and gentlemen, the Z benefits for breast cancer has arrived with a substantial increase in terms of amount, and it has arrived way ahead of schedule, Sir Mandy. So, and with a lot of promise. We are friends. So, but a lot of work has yet to be done. Kaya humihingi po kami ng tulong po sa inyo so that we can contract more hospitals into the program, guide more patients, and of course, sabi nga Sir Mandy, bayaran namin yung claims, no? Yung mga hospitals na nag-avail ng benefit. And with that, we now formally close our kapihan with the media today. Maraming salamat po sa inyong pong pagdalo. Mabuhay po ang PhilHealth, mabuhay po ang bagong Pilipinas. Maraming salamat. Thank you.